A few years back in the USA, a well-known ENT surgeon was shot dead by one of his patients. And this shocked the nation and the world in general. What was the patient suffering from, you ask me? Not a tumor, not a hideous facial scar, nothing. The patient was suffering from this annoying buzzing, ringing sound in his ear. And that is what we're talking about today. It's called tinnitus, and it's one of the most common things that affect people and one of the most common things we see people for in our ENT practices. So let's talk about ringing in the ear, also known as tinnitus. Namaskar. This is Dr. Bhattacharya ENT and I am Dr. Diptarka Bhattacharya. So to understand what is tinnitus or ringing, let's first see what people describe it as. It is one of the most common things that people walk into our clinics with. And people often describe it as a ringing sensation in the ears. Some people call it a buzzing sound. Some people call it a hum. There are many different terms people use. But the one common thing is it's an extra sound that you can hear inside your ear when there is no other sounds. So let me first explain what is tinnitus and why that happens. The first thing that we need to know is that tinnitus is not a disease. Tinnitus is just a symptom. There are many different things that can cause ringing in the ear. That means that there is no magic cure. There is no one medicine that's going to work for all patients. There is no one treatment that will work for all patients. It can be caused by something as simple as wax buildup inside your ear to something as complicated as a small stroke or a tumor that is growing inside the ear. So in the next section, let's understand what is the pathology or why it occurs, and then we'll go on to the diagnosis, the treatment, and how we can help you lead a perfectly normal life. To understand what is tinnitus, let's take the example of an old radio. If you remember the old radios, they used to have a dial that would move up and down, and that's how you would hear music. So suppose you have an old radio at home and you're trying to hear some music, but you don't have it pointed at any of the specific channels. But you keep turning on the volume because you're trying to listen to music. Well, you're not going to hear any music because it's not picking up the sound waves. But over a period of time, you're going to start hearing a static, crackling, buzzing noise because you're going to hear all the normal interference in the sound waves that exist. That's basically exactly what happens for tinnitus. So what tinnitus means is that for some reason, there is a part of your hearing spectrum that is not working. And your brain thinks that, hey, the reason I'm not hearing the sounds is because I am not sensitive enough to pick up the sounds. So your brain basically tries to increase the gain. And because it keeps increasing the gain, at a certain time you start hearing all the mechanical noises that originate inside your ear, and that is what you interpret as tinnitus. So if you understand that, you will understand that there are basically two reasons why you can get tinnitus. Reason number one is, like I said, for some reason a little bit of hearing is not working great. The second reason is your brain, for some reason, is hyper excited, and it keeps on understanding, or it keeps on increasing the gain and picking up signals that are not existent. There is also a third cause in which there are other things which are not essentially related to the ear that is creating a mechanical sound, and that is what your brain is reading. That's not true tinnitus, but it's often something people come to us with, so I thought I'll explain. Now, let's go back and look at all these things. So number one, hearing loss. So a part of your hearing spectrum may not be working, and this can occur because of many reasons. There may be a small stroke that has killed a little bit of the nerve. there may be a small tumor that is sitting on the nerve. There may be other things that are happening. It may be age related, it may be autoimmune. There are many things, but basically anything that is causing a part of your hearing to not work can lead to this. In the second group, we get things like anxiety. Okay, we get things like hyperthyroidism, anemia, anything basically that can overexcite the brain can lead to tinnitus. And number 3 is the other things that can cause a mechanical sound, and this is the group in which we get wax in the ear, where every time you try to open your mouth or something, the wax moves and it creates an annoying sound, or something to do with your jaw joint, in which case you move your joints or you open your mouth and it leads to a crackling sound, and that is what people understand. Now there are other rarer causes, things like a very large eustachian tube, which is a tube that connects the ear into the nose. There are rare things like muscular disorders like palatal myoclonus, in which basically your muscles keep spasming, which leads to sounds. There are other abnormal vessels that may run right over your hearing mechanism, and those vessels can lead to a pounding and pulsing sound that people talk about as tinnitus. So now that you understand the number of different things that can cause tinnitus, you are at a right place to understand how we proceed, what our workup is, how we diagnose the disease, and then how we treat it. So let's talk about that in the next section. So by now, it should be fairly clear to you how we proceed with tinnitus. It's fairly logical. So whenever someone walks into our clinic and says, I have ringing or tinnitus, the first steps involve 2 things. One is looking inside the ears, assessing the joints, assessing all the areas around it to see if anything around it is causing that extra sound. Now, if you walk in and you have the ringing or buzzing in your ear, and I look in and there's wax, well, pretty simple. We go ahead and clean the wax out. If the tinnitus resolves, great, then it was wax. If not, then we have to start testing for it. Now, suppose you walk in and I look in your eardrum looks okay, nothing else to worry about. Well, then the first question is there hearing loss or not? So the first step is always to get a hearing test done. And the hearing test in this situation is needed even if you don't have a hearing loss, because if you understand this correctly, then most of the times these hearing losses are localized to one area, and it may not be something that we use in our speech. So a lot of times as a patient, you may not even understand that hearing deficit that you have, but the hearing test will pick it up. So once we get the hearing test done, now we understand if the person has a hearing loss or does not have a hearing loss. So we'll talk about these 2 things separately. Now, if you have a hearing loss, then immediately the next question becomes, can this be something dangerous? For example, can this be a tumor? Can this be a stroke? Can this be something that can cause a threat to your life? And anytime in any ENT situation, I have this question where it can be a threat to your life, the next step is always to rule that out. Irrespective of how rare it is, irrespective of how likely it is, our next step is always to check for it and rule it out. So when someone walks into our clinic with tinnitus and we see there's hearing loss, and the type of hearing loss makes us suspicious that it may be a tumor or something like that, the next step is to get imaging. Imaging can be HRCT scans or MRIs, which is more usual. But essentially what your doctor is trying to understand is there a tumor, is there a stroke? Now, if your hearing test results are not suspicious of this, then we go on to the next step. This is kind of like what we're doing in case we do the hearing test and there is no hearing loss. So provided that there is nothing dangerous and we have found that you don't have a hearing loss, or you have a hearing loss and we have done the imaging and it is normal, well, treatment is kind of individualized. That means there's no one specific treatment that works for everybody. So let's talk about these 2 groups separately. If you have a hearing loss, you have ringing, and there is nothing dangerous, well, the first step is of course to sensitize your brain and to let your brain know that, hey, all these sounds that you are hearing are normal. So this is where we use something called retraining and desensitization. This is where we use different applications or website tools to add extra sound to the brain so that your brain kind of gets used to this constant sound, and basically it learns to ignore the low-level sounds that your ear is making. There are also other things we can use, like hearing aids, which basically work on a similar principle, wherein it brings up the hearing to normal levels. So obviously your brain understands and it starts to hear in those frequencies, and your tinnitus helps. So these are the most common ways to treat tinnitus with hearing loss. Now, if you have tinnitus and you don't have hearing loss, in that situation, we are mostly looking at a few things. The first thing is medicines. So if you have anxiety or hyperthyroidism or something like that that is making your brain hyper anxious, of course we use different groups of medicines to take care of this and to desensitize your brain. There are different algorithms and different criteria for starting medicines. The basic thing to understand is there is no one medicine that works for everybody. This is more of a trial and error process. So it's really important that your doctor and you are a team, and you communicate very freely, because please understand there is no one medicine that will work for everybody. Sometimes when we have tackled all these things and used medications and all these things, and we're not able to get complete cure, we start using other aids. Other aids can be meditation, behavioral therapies, vibratory stimulatory therapies, in which we basically use vibration as a sense to fool the brain into thinking that it can hear sounds and basically desensitize it. These are all therapies which take about 3 to 6 weeks to work. And with these, once they're customized and used, with these, about 90 to 95% people find relief. There is still gonna be about 2 to 5% people who do not find relief with all of these things. And at that point, it's really about discussing with your patient and trying to understand how much it affects them. Most of the times, a thorough discussion and good counseling and involving experts in psychotherapies and behavioral therapies can get us excellent control and excellent results. The most important thing is to make your patient understand that the effects that they're having is not something unique to them. They're not crazy and you're not disregarding them. We just have to give it time and treat it as a team, and most of the times we can get excellent results for this. Coming back to tumors and stuff like that, most of the times we are operating on these. There are multiple other options. Radiation, stereotactic therapies can be used for these tumors. They're usually rare tumors. The good news is they're usually not cancers. So if we are operating on them, we are usually using small approaches with an endoscope or a microscope, making a small cut behind the ear, and we're trying to take out the tumors. That's a whole topic, and that's a topic we're discussing another day. But irrespective of what goes on, most of the times these tumors have to be handled very specifically and with a lot of control and with a lot of technology, just because there are so many different nerves that run through this area and we have to protect all of them. So that gives us an idea about what tinnitus is, and in the next section we'll just sum up. So to sum up, ringing in the ear or tinnitus is a very, very common condition that we see patients with. If you or somebody you know is suffering from this, please know that about 95% of patients can be treated, cured, and controlled with great success. The important thing to understand is that this is not a one-off magic treatment, because the causes of tinnitus can be very, very, very different. The diagnosis and the treatment must follow a stepwise algorithmic approach, and with that we can most of the times come to a solution for the patient, allowing them to go back to absolutely normal life with no restrictions. Most of the times these treatments take about 3 to 6 weeks. So when someone walks into my clinic, the first thing I do personally is I discuss with them about this stuff, and I tell them that, sir, This is not a magic. I don't have a solution in one day. We have to go stepwise. We have to find the cause and treat it. So you have to give us time to identify the disease and treat you so that we can get you back to normal life. If you would like to come into our clinics, you can always go to the website below or reach out to us and visit us at any of our physical locations. Most competent ENT surgeons who follow a stepwise approach should be able to take care of it. And if there's any issues that you're facing, let us know. We'll do our best to help you. Take care. Like, subscribe, do all the things that usually people ask you to do. And I'll be back with you guys with another video hopefully soon. Take care. This is Dr. Bhattacharya.